Organization also defines good health. Now what is good health? Because when the patient doesn't have to go into chronicity and has to in fact go the reverse way to cure diabetes, that is, you are restoring good health. That is why I have put here that good health is a state of physical, mental and spiritual well-being with absence of disease or infirmity. This is where I can say that yes, we can cure diabetes. Why? Because we are restoring their good health. The diabetes, the sugar levels are not increasing for more than 1 year, 2 years, 3 years. They are living a good health with a good physical, mental and spiritual well-being, which is very important. And there is no recurrence of diabetes, isn't it? So what do we understand by diabetes at the metaphysical or psychological level? Because as per the World Health Organization, it also says that it is also a state of well-being of spiritual. And that is why we say that holistically we need to understand at the psychological level what is diabetes. If you see your patients, if you start noticing from today itself, you will find all diabetes patients are very, very loving. They are so very loving, and it's a general rule of nature that whatever you give, you expect. Not today, tomorrow, maybe years after. So all diabetes patients have wish for love paired at the same time with inability to let oneself be loved. Now what does this mean? This means that that patient is very loving to the extent that they love so much, but they do not, when they are given that love in return, they say, "Iski koi zarurat nahi. There was no need for you to do this, I was okay with that." And what happens over a period of time? The person who loves them stops loving them. Stops loving them, getting gifts for them, showing their love in expression in other ways. And when this happens over a period of years, and if it is having a genetic factor or a viral infection or some hormonal disturbances at a later age, you may fall into the category of diabetes. So what can you counsel your patients on this? Is that you express your gratitude. You tell them that when somebody loves you, when somebody expresses your love, you're getting the return of your love. You thank them. You express your gratitude to them. And you accept love and thank, receive, relax and have faith in yourself that you have done the right thing. You can accept. It is not that you cannot accept. This is the main important mental clause of curing diabetes. And you have to keep on constantly counseling, grooming the patient for this. Because it has been years he has not followed this, and it will take a long time to get them into that lifestyle modification of accepting love. It will literally sometimes, groom them for that. Let's say thank you, give a hug, all these things. These are small things, but it's very important. At the hormonal level, there is a disturbance due to reduced production of insulin in our body. The beta cells of pancreas, hence there is an increase in sugar. All these things we know. As doctors, we all are aware of all these things. It is a metabolic disorder to use sugar maybe due to genetic and hereditary disease or viral infection. Now, if at all there is a history of viral infection in the past, the patient may fall into diabetes due to that can be a causative factor. Like genetic and hereditary, this is also a very major factor. What can we do in this is, we have to train the patient to improve his metabolism and energy levels, help him maintain their hormonal balance and nutritional requirements and have a healthy life. Now, there's a patient in USA who has cured her uterine fibroids just with spiritual well-being and natural supplements. These natural supplements, when taken in a concentrated form, have a lot of power in it and builds up your immunity to such an extent, mental and physically, that you become stronger to defeat the disease. At the physical level, body loses ability to convert fat into energy and your body starts accumulating fat, leading to obesity, hypertension, liver problems, kidney problems, glaucoma, skin ulcers, gangrene, cardiovascular problems, ketoacidosis, leading to coma and loss of energy. Loss of energy is the most important criteria because the body is not able to convert fat into energy. And over a period of time, there is nutritional depletion, There's a lot of loss of energy because of that, and that is why, because the immunity is low, the body goes into more chronicity. From diabetes, they travel towards hypertension, cholesterol, kidney failure because of low immunity, because of the nutritional depletion. Here you have to make the patient aware that to have systematic screenings, so that because of that loss of energy, because of the body's inability to convert fat into energy, they are not going into any other category like liver failure or kidney failure, something like that. So they have to keep a check, a regular check of blood pressure, cholesterol. I mean, we all know this. You have to just train the patient. See, here what I am trying to say is that we all know this, but we need to educate the patient. That see, this is all happens in your body, and you have to take your regular screenings because of this. You have to watch your fat intake so that you don't fall into the category of obesity. That is another big problem in India now today. You have to burn your daily fat. We already guide the patients that go for a walk daily, 1 hour, 2 hours, so that you are burning your fat daily. This is what we are complying. The patients also are complying. They are also much aware of it. Like they are aware of that, we have to make them aware what happens in their body when they fall into diabetes.